Good morning, students. Today we are going to study about epilepsy. Epilepsy, or the common terms which we hear is convulsions or seizures. Let us first understand these terms before we define the term epilepsy. Now, convulsions is you can see a sudden violent movement of the body which you cannot control. It is a sudden violent movement of the body which you cannot control. And seizure is a single episode of where there is disturbance in electrical firing in the brain, and it is a single episode. A single episode is called as a seizure, whereas a convulsion is a sudden motor violent movement of the body that you cannot control. And epilepsy is, if you can define, it is an umbrella term. This is a big umbrella term which is given to when two or more recurrent seizures occur. Then it is termed as epilepsy. So we can say that seizure is a symptom of epilepsy. Fine. Seizure is a symptom of epilepsy. So now we have defined, like, the common terms related to epilepsy is convulsions, which is a violent movement of the body that cannot be controlled. Seizures, which is a single episode of electrical disturbance in the brain. Now, what is electrical disturbance? That is firing of the neurons, which is uncontrolled firing of the neurons takes place, which is called as hyperexcitability of the neurons or hypersynchrony of the neurons. We will be discussing this later on in this video. Now this seizure need not to be a convulsion. Try to understand the fact. The seizure need not be a convulsion. It can be a single episode of loss of consciousness or sudden flashing of lights, or the reason may be because of low blood sugar levels, or there can be sudden change in a behavior. The person can be irritable at a time. So these all come under the term called seizures. Seizure, it is a single temporary electrical disturbance in the brain. Fine. And it can be simple as it can be just the person can have flashing of lights and there can be sudden change in behavior, or there can be sudden loss of consciousness. The reason can be low blood sugar level. Whereas epilepsy, we term it as epilepsy when this occurs 2 or more times. When seizure occur 2 or more times, then we categorize it under epilepsy. So epilepsy itself is a chronic neurological disorder. And we need to understand this. It is a chronic neurological disorder. It is a chronic neurological disorder, and which is paroxysmal. Paroxysmal means sudden. All of a sudden this will happen. It may happen periodic after some time. Periodic motion, we have already know this term, periodic, after some time, periodic, and it is reoccurrence of symptoms takes place. Fine. It is sudden and it is periodic. Then there is uncontrolled discharge of neurons takes place, which can be clinically manifested as from a range of motor convulsion to a brief episode of lack of awareness. That means this clinical manifestation can be anything. There can be a motor convulsions, that is violent shaking of the body, or it can be just brief lack of awareness or lack of consciousness of a person. So let us define epilepsy now. Epilepsy is a chronic neurological disorder in which is paroxysmal, uncontrolled discharge of neurons takes place and is clinically manifested range from motor convulsion to a brief period of lack of awareness. There are certain stages of convulsion which is said to be prodrome stage. Prodrome is a stage. It has got 4 stages before when we define epilepsy, we have to define these 4 stages of it, which is very much important. Prodrome stage is a stage where there is sudden mood and behavioral changes which happen just preceding to the attack. We say this attack as episode of seizure or episode of motor convulsion. Fine. So prodrome is a stage where the mood and behavior changes takes place just before the attack, which it is for hours before the attack. It may be 6 hours before the attack or 5 hours before the attack. That is called as a prodrome stage. Usually the patient says, when we going for a detailed history taking, patient says that he was having a sudden ringing sensation in the ear for the round about 5 to 6 hours before. In the morning he was having this ringing kind of a ringing of the ear sound was there for 4 to 6 before this episode came. Fine. Then aura stage. Aura stage is immediately before the episode. That is, some symptom will appear immediately before the episode. The patient may say that he was having flashing of light. एकदम आंखों के सामने रोशनी आ रही थी. Find the symptom immediately before the episode. Then is the ictus stage. Ictus stage is the seizure itself. The episode itself is said to be the ictus stage. And then post-ictal period. Post-ictal period is a period where the person is totally confused. The episode is over. The person is totally confused. He is totally disoriented what has happened. And he has he tries to get into normal behavior, automatic behavior. We will discuss about it because he doesn't remember it thoroughly, what episode he has gone through. So it is prodrome stage, which is mood and behavioral change, which is 1 hour or few hours before the attack. Aura stage is the symptom which happens immediately before the seizure. Ictus is the seizure itself, whereas post-ictal period is the period where the time in which the patient has, it is after the episode of seizure and which patient is confused and disoriented. Fine. So this is how we define epilepsy. We have defined epilepsy. We have now understood what is the difference between a convulsion and what is the difference between a convulsion and a seizure, and what is an epilepsy and what are the stages in which it can be understood or it is important. Now let us understand the pathophysiology. What is happening here? Now if we can see the pathophysiology, and now if we can see the pathophysiology, pathogenesis, we understand this is because of the imbalance between the excitatory and inhibitory neurotransmitters. Excitatory and inhibitory neurotransmitters. There is an imbalance between the two, which leads to hyperexcitability and hypersynchrony of the neurons. They remain hyperexcitable and the neurons are firing continuously. Fine. Now, to understand what is excitatory, in my previous videos where we have discussed about movement disorders, direct and indirect pathway, we have already discussed about excitatory neurotransmitters. Just to give you a revision, excitatory neurotransmitter is the glutamate and inhibitory neurotransmitter is the GABA. Now, excitation is, it can happen. Now, this imbalance can be either the excitation is more or there is lack of inhibition. So in both the condition, there will be an imbalance of the imbalance and result in hyperexcitability of the neurons. Now when there is increase in excitation or increase in the activity of glutamate, what will happen is there will be excess neuronal firing will be there. Second is when there is loss of inhibition, which is reduction of GABA receptors, this will also result in an imbalance. Now this is a kind of where I am trying to show you the synaptic transmission. That is, it is a you can see how the signal passes through. It is a synapse. You can see here in the calcium channel and the sodium channels are there. Here the signal passes as the, and it is the receiver end. Now the excitatory neurotransmitter, basically that is the glutamate, they have got receptors which is called as NMDA receptors, which releases the calcium and as soon as the calcium is released, it comes inside, it causes the signal to transmit and goes and receive these transmitters, or these are received by the receptors, and the signal is transmitted forward. Now once the signal is done, there is a role of an inhibitory neurotransmitter, which is GABA receptors. They basically allow the chlorine to come inside, and this closes the signal. So they have got a balance. The excitatory neurotransmitter and the inhibitory neurotransmitters are in balance. The excitatory will allow the signal to pass through it, whereas the inhibitory will allow the signal to stop. Now whenever there is a dysfunction between the two, this will allow calcium to come in, this will allow chlorine to come in, and the signal stops. So whenever there is a dysfunction between the two, this results in hyper excitability and hyper synchrony of the neurons. Okay, I hope you have understood with this pathogenesis. Now let us see what is the clinical presentation. Now if you can see, the clinical presentation is, now depending upon the area which has been affected, whether it can be half of the hemisphere may be involved, or one lobe may be involved, or there can be involvement. Depending on the area of the involvement, we say it as it is partial seizure. Okay? The partial seizure is, we defined it into two parts. Partial seizure, where one part of the brain or one hemisphere is involved. Generalized seizure is when both the hemispheres are involved. So it is classified into two types. One is the partial seizure, when there is one half of the hemisphere is involved, or one lobe is involved, whereas generalized is both the lobes are involved. The partial seizure is divided into two types: the simple partial seizure and the complex partial, depending upon whether here the patient remains conscious throughout the episode. Here the patient loses his consciousness. Its impaired consciousness is there. That is why it is divided into two types: simple partial and complex partial seizure. Fine. So the simple partial seizure is further divided into motor seizure and sensory seizures. Now motor seizure is strange sensation. Depending upon which area is involved, there will be strange sensation will be there, like there will be visual delusions, hallucinations, or flashing up of light when the occipital lobe is involved, or visual cortex is involved. Or there can be auditory involvement of, there will be tinnitus will be, or ringing sounds in the ear will be there. Fine. And there will be pain in the ear can be there. There will be auditory hallucinations. Hallucination is as if the person is, the sound is not there, but the person is believing that there is a sound. Sometimes the person is feels like that there is somebody who is whispering in his ears. So that is called as auditory hallucinations. Fine. So it can be a sensory, whether it can be a visual hallucination or auditory hallucinations and deliriums can be there. Or it can be motor. Simple partial seizures are depending a jerky movement in a specific muscle group, depending on the area which is involved in the frontal lobe, whether which area is involved, then it is called the jerky movement happens. Fine. Whether it can be in the fingers, it can be head, it can be face. There is a typical word which is important over here, is that is called as Jacksonian march. Now Jacksonian march is whenever this partial seizure happens, it starts in one group and then it spreads to the other muscle group. Fine. It is an involuntary movement and it mostly affects the hand and the face, and it is a clonic type. Clonic type is when it flexes or when the tone of the muscle increases. There is a sudden shaking movement takes place. So Jacksonian march is, it starts from a small muscle group of one hand and then it involves the hand, then it involves the whole arm. Fine. So herein this is called as a Jacksonian march. It can happen in the face also. There can be twitching of the eye as well as the winking of the eyelids. And herein you can see the patient's head will turn away from the site of its focal origin. Fine. So this is one of the things which we see. And herein the patient is very much conscious and he remembers this episode has happened. Now, an important thing over here is Todd's paralysis. After this episode is done, there is one condition which is called as Todd paralysis. Now what is Todd paralysis is that the person feels there is weakness in one side of the body. The area which the group is involved, there will be weakness of that size or paralysis of that size. The person will find very difficult to move the hand if it is involving the hand, and this may happen, it can happen within, it should happen within 15 hours and to 2 days. This weakness should go away. Fine. So this it maximum these effects or this weakness remain for around about 2 days, not more than that. That is called as Todd paralysis. Fine. And in complex partial, the presentation is the same, but herein the patient is not able to remember anything, and it basically herein it involves the sensory cortex, that is parietal lobe and frontal lobe is more involved. Occipital lobe is also involved. Herein the temporal lobe is involved. The complex partial seizure where there is loss of consciousness, the temporal lobe involvement is more there. Fine. So the partial seizures are seizures in which only one half of the hemisphere is involved or one lobe is involved, and depending upon whether the patient will remain conscious or not conscious, it is divided into two types: simple partial and complex partial. And we have now also studied about what are the motor simple partial seizure or sensory seizures. And there are two important terms over here is Jacksonian march and Todd paralysis. Fine. Now coming to the next part is generalized seizures. Generalized seizures are seizures where both the hemispheres are involved. Both hemispheres are involved. Now it is basically been classified as tonic seizures. Tonic seizures are seizures in which there is increase in the tone of the muscle takes place. There is sudden stiffness of the muscles takes place. Whereas clonic is the relaxation phase where the muscles decrease in tone is there, and there is a relaxation which takes place. It can happen separately or it can happen together. This tonic clonic seizure, which is also called as grand mal epilepsy. Grand mal seizures. Fine. Where there is a tonic stage which happens for 10 seconds, that is contraction or stiffness of the body takes place, followed by a relaxation phase which happens for 1 to 2 minutes. So that is called as tonic clonic seizures. There are other type of seizures which are also there, which is called as myoclonic seizures, which happens in the short muscles such as muscles of eyelids, or there is muscles of hand. Short muscles, twitches of the short muscles is called as myoclonic kind of a seizures, which happens in infants and children. Atonic seizures in which the tone is reduced. It is floppy tone happen. This is also found mostly in children. And then there is absence seizures, where this also happens in childhood. This is called as the patient is or the child experiences around about 5 to 10 times episodes of seizures in a day, and which lasts from 5 seconds to 15 seconds, where the person is totally spaced out. He is totally there is vacant. There's vacant eyes are there. We will discuss this in detail. Now let me first the most important one. This is absent is also called as Petit Mal epilepsy. Now I will be taking this in detail. This is very important. Generalized seizures where both the hemispheres are involved. The first type I have already here described: tonic type, clonic type, tonic clonic type, myoclonic type, atonic type, and absent seizures. Now let us take the two detailed one, which is called as grand mal and the Petit Mal epilepsy. Okay. Now this is tonic and clonic seizure, that is the tonic phase happens just for 10 seconds. Fine. And the clonic phase is followed by it, that is for maximum to 2 minutes. Fine. So it's a tonic phase. Here the eyes are open, elbow is flexed, arms are pronated, legs are extended, teeth is clenched, pupil is dilated, and breath is held, and the person goes into cyanosis, that is blueness takes place, and bowel and bladder control is totally lost. Can you see the tonic phase? Everything goes into contraction. Eyes, though they are open, whereas elbows is flexed and pronated. Elbows flexed and pronated, legs are extended, teeth are clenched, pupil dilated, breath is holded, and bowel and bladder are control is lost. During this phase, there is a typical called as Leptic cry is there. What is epileptic cry? This is because of the contraction of the respiratory muscle and partial closure of vocal cord. There will be a typical epileptic cry will be there during this phase. This is called epileptic cry. Is a tonic contraction of the respiratory muscles with partial closure of vocal cords. Fine. And what happens in the clonic phase? After 10 seconds, it is followed by a clonic phase. What is in clonic phase is there will be generalized shaking, tremor will be there, eye will roll backward, tongue will be bitten, tachycardia increase in the heart rate will take place, breathing will start at the end of this phase. Breathing again starts at the end of this phase. Fine. So this is the tonic phase which lasts for 10 seconds where the tone or the stiffness of the body takes place. This is followed by relaxation of the body. Fine. When the relaxation takes place, it's followed by tremors, rolling up of the eyes, tongue is bitten, there's increase in heart rate and breathing starts at the end of this phase. This is called tonic and clonic phase. There is another thing which is very important over here which I want to discuss is if this is called as tonic clonic or grand mal. Okay? Grand mal. This is called as grand mal epilepsy. Now, if this condition lasts more than 5 minutes or there are two episodes of tonic clonic, that is 10 second followed by 2 minutes, then there is a pause and then again this starts again. There are two episodes of tonic clonic. This condition is called as serial epilepsy, or it is a stage of medical emergency which is called as status epilepticus. Which is called as status epilepticus. Fine. Where it is becomes a medical emergency where the person is given diazepam and relaxation should be done or immediately he need to be taken care of. Fine. So this is a condition which is very much important and it becomes an emergency stage. Fine. So the second, this was about the first one, the tonic. It can be tonic, clonic, which is grand mal kind of an epilepsy. The second which is important is absence epilepsy, which is also called as Petit Mal epilepsy. Petit Mal epilepsy. This was tonic and clonic phase. This is Petit Mal. Okay. Sometimes in exams we get explained about grand mal epilepsy and then compare the grand mal with the Petit Mal. So this is important. Now this is basically in childhood with the age group of 4 to 12 years and it may occur many times in a day. Duration can be 5 to 15 seconds where the child stares vacantly. Eyes may blink. There will be monoclonic jerks, that is the monoclonic are twitches on small muscles, twitches of small muscles. The child will hyperventilate and there will be hyperventilation, he will be vacantly looking eyes will be there and the child's scholastic performance will decrease. In school, there will be continuous complaint that the performance of the child is declining. And in the childhood, this Petit Mal, 30% of this Petit Mal changes to grand mal in adolescence. These children who suffer from Petit Mal kind of an epilepsy converts into grand mal in the adolescent stage. Grand mal in the adolescent stage. So this is very important. These two are very important, grand mal and Petit Mal kind of epilepsy. This is very much important. Now let us see what are the features we see or what are the other signs we get in this, and this is very important also. Now what all disturbances are there? There is visceral disturbances. Now visceral disturbances are, there will be gustatory, there will be tasting, disturbances in taste, disturbances in olfactory, smell, which will be in the form of hallucinations. Fine, which will be in the form of hallucination. Visceral disturbances, signs of visceral disturbances will be there, like there will be gustatory, a certain time of a taste hallucination will be there. I am having a bitter kind of a taste throughout this episode, or I am getting a jasmine smell, or smell is there, hallucinating for smell as well as taste. Lip smacking will be there. the patient will complain of fullness, epigastric fullness, that is nausea, and there will be choking sensation, as if epigastric fullness we get it when we are when the stomach is full. That kind of a fullness will be there, and tachycardia, increase in the heart rate will be there, nausea will be there, choking sensation, and there is dilatation of pupil. There will be dilatation of pupil. These are the visceral changes which happen when there is an episode. So there can be, there need not be all the changes are there in a patient, but yes, these kind of changes are seen, visceral disturbances which are seen when a person suffers with an episode. So there can be gustatory, olfactory, lip smacking, epigastric fullness with nausea and choking sensation, and pupillary dilatations are there. Now what about memory disturbances? Now, memory disturbances, there are few terms which you need to remember. This can come as a short term also. One is deja vu. Deja vu is something has happened before. Whatever is happening now, I have seen it before. This is called as deja vu kind of a feeling. These people, they often suffer from these kind of a condition, deja vu, that this has happened before with me also. Then there is another called Jamia's view. This is something that is feeling of unfamiliarity. Unfamiliarity is they are sitting in their family and then they feel like, no, I'm not familiar with them. So there is a feeling of unfamiliarity, or the normal routine, whatever they used to do it in a normal routine, they are finding it unfamiliar. So there's a two conditions. There's another condition also called as depersonalization. Depersonalization is there is a feeling that they are detached from their own body, that this is all happening in a dream. They are like a robot. So this is called as depersonalization. Fine. Then there is another form called derealization. They feel that this world is or the external world is unreal and everything is false, everything is distant. So their perception of the world has changed. So and then there is flashbacks. Flashback is the events which has happened in the past is happening now. That is called as flashbacks. And of course, visual hallucinations. These are the disturbances they have. Deja vu, that is something has happened before. Jamia's view, where is feeling of unfamiliarity is there, which is very normal routine. In the normal condition, the feeling of unfamiliarity is there. Depersonalization is their feeling of that they do not belong to this body, and they are just like a robot, and they are just living in a dream. Derealization is that they perceive this world as unreal. The external world is unreal and this all is false. Flashback is the experiences of the past, they feel like it is happening in present. And there is visual hallucination. I give an example of visual hallucination is there is a rope in a room and they feel like that there is a snake in the room. So this is called a visual hallucinations. Fine. Then another thing which happens is automation. Automation or automatism. That is after the episode they have clouding in consciousness. That is, the consciousness is not clear. And what happens is it is an involuntary motor activity happens, and this can be ambulatory automatism, where the patient wander off. That means अपने आप घर छोड़ के भाग जाना. The automatic ambulatory automatism हम इसको कहते हैं. That is, there is because they have lack of, or there is clouding of their consciousness. They don't realize what has happened. So they have this is an involuntary motor activity starts happening, which is not under their control. And most commonly which is seen is ambulatory automatism. That is, a subject wander off. He goes off from the house, and then it is very difficult to find them. So of course confusion and headaches are also there. So what kind of a disturbances this episodes or the patient suffer is visceral disturbances, memory disturbances, automatism, and confusion and headaches are there. Fine. Now let us see what treatment we give. And now basically we have got MRI, CT scan and EEG, electroencephalogram. Now it basically checks our alpha and beta waves of the brain, and it is electrical signals of the brain are being checked, and herein there will be basically see the sleep pattern of the patient, which is random eye movement, and there is non-random eye movements are being checked with alpha and beta waves are being checked, and we come to know what kind of an episode is there, which kind of whether it is a myoclonic type. It helps us to define the type of epilepsy. Fine. Of course, MRI and CT scan help us to tell whether it is the episodes of seizure are because of any other conditions like brain tumors, or it can be abnormal blood vessels. Fine. So these are the scans which we can do. So what treatment we have to give is daily medications. Of course, if it is a blood maintenance of vitals should be done. Anticonvulsants are given so that this can be controlled. Mostly diazepams are given. And there is other condition is epilepsy surgeries. Now basically if there is a reason of this epilepsy such as tumors or rupture of blood vessels, then this need to be removed. So that cause need to be removed. The next thing is nerve stimulation. The new thing which has come up is nerve stimulation. It is basically vagus nerve stimulation which influence the neurotransmitter release. If it is because of the imbalance between the neurotransmitters, then vagal nerve stimulation is done. Fine. Another thing which is very much important over here is they have been suggested to go for a ketogenic diet. Now basically this ketogenic diet forces the body to burn fat instead of carbohydrates. Now once the fats start burning, there will be production of ketone bodies, and brain starts taking energy from these ketone bodies rather than from the glucose. So this is the basic idea. Whether this is still under study, ketogenic diet, how it is going to affect or how it changes, and it's helpful, it is still under study, but it is nowadays it is recommended. Ketogenic diet is recommended. Now the questions which are generally being asked from this is, which are very common, is one is differentiate between epilepsy and seizure. Differentiate between epilepsy and seizures. Then the next question which is asked is differentiate between grand mal and petit mal epilepsy. Fine. And then there are 2 number questions which are also being asked, that is what is status epilepticus, or what is Jacksonian march, or what is Todd's paralysis, or what is epileptic cry. We have already discussed everything in this video. You need to see and try to frame your answers accordingly. These are the common questions which have been asked in this topic. I hope you understood this topic, and I'm open for your suggestions as well as your questions. Thank you.